Hi everyone, good afternoon po and thanks for joining us. It is a Wednesday today and we are happy to have you join. I'm Dr. Anna York Bondoc. I'm here with my nurse, Miss Reina, and our assistant, Miss Kat, and we are here to bring you libreng konsulta. Sorry po talaga, we are not as live as we used to be. That's because we're really busy po campaigning for Congress. But hanggat maaari, magproduce po kami ng live content for your information. We are live po on YouTube. Please follow us, Dr. Anna York Bondoc. Nandun din po kami sa FB Live, Dr. Anna York Bondoc, and now on TikTok. So, our topic today is GERD, Gastro Esophageal Reflux Disease. Please put your questions below lang po. Marami na pong questions na this was postponed from yesterday. So, we have a lot of questions and comments left over from yesterday. But you are very, very welcome po na maglagay. So, our topic po is GERD, G-E-R-D. Paki-type lang po. And we'll be happy to answer all questions. So our letter sender comes today, Dear Doktora, ako po ay 45 years old and aminin na po, medyo chubby. Okay? Ang problema ko po, parating umaasim o parang asido ang panlasa ko, especially at night. Okay? Ako po, feeling ko pag nangyayari yon, masakit ang aking dibdib at dighay po ako ng dighay. Sometimes, I'm worried. Baka serious na po itong problemang ito. So, doktora, please help me. So, napakaganda po nitong question na to, no? And it's a very common issue po talaga. And this is what we call GERD, G-E-R-D. And himayin po natin yung mga symptoms. Classic po yung symptoms nung nagpadala sa atin. She's of an older age group. Medyo chubby or actually so obese. Yung lasa po ng acid or talaga pong parang mapait na panlasa comes up. And it usually happens sometimes, most often po in the evening, nangyayari po yan. So these are all classic symptoms of GERD or gastroesophageal reflux disease. So tingnan po natin ang first, ano bang nakalagay? Do we have a question or, yan, what's GERD? Okay, ang ganda naman. Obvious ba? Ang ganda ng ano. That is the number one question. What is GERD? GERD, no? It's pronounced G-E-R-D. You can say G-E-R-D, though most people tend to say GERD. That is the short for gastroesophageal reflux. So what's the meaning of the, himayin po natin yung pangalan, ano po? Wait lang. Ako po ay tinetext ng aking pinsan. She doesn't know I'm live. I'm sorry about that. Opo. Okay, gastroesophageal. Anong meaning nito? Okay, paki-type lang gastroesophageal. Gastro means stomach, okay? And esophagus, yun po yung daanan po when you swallow your food, okay? It goes down what we call the esophagus. Paki-type lang, sorry. Mabagal lang po kuminsan. Yes, gastric. Two main organs, no? The gastric, the stomach, and the esophagus. Yun po yung lalamunan pababa, okay? It's a long tube that connects po yung ating mouth and oral cavity. Dito po, you can feel it. Oh, this is the esophagus right in front po. Ano? May rings po siya. Okay? It goes down until it reaches the stomach. Yun po yung gastric or gastro. Okay? So, doon po nakukuha yan. So, between the stomach and the esophagus, meron po tayong parang one-way, it's a tight, it's a tight opening. It's a valve. And yun po yung separates po. Para pag bumaba po yun, hindi na po babalik. Dapat sumara po yun. It is, nangyayari po yan when umaakyat po, our gastric contents. What happens in the stomach? May stomach acid po yan. Parang it melts the food that we ate, no? And then, pag nagba-backflow po o nagli-leak back, yung atin pong esophageal contents, ang nangyayari po, bumabalik po yung acid and we can taste it. So the term is reflux. What is the meaning of reflux? Reflux is to go back. Ano po? So ang meaning po nito is the gastric contents go back into the esophagus. Sometimes paakyat pa nga po and we can taste it and it is very unpleasant. Okay? So yun po yun. Sometimes it's called Madali lang po, Okay. So, pumabalik po, no? Reflux, yes. Sorry, my cousin is asking for the bank account of Benji. Yay, Christmas gift. Okay, mga ano, ninong and ninang. So, yun po, no? The gastric contents are chewed, are swallowed in the mouth, go down the esophagus, goes into the stomach. Ngayon, bumabalik po siya, the stomach digest the food, and then bumabalik po yung acid, and that is what we can taste. So, that is what we call po na Gastro Esophageal Reflux Disease, or what we commonly call GERD. Hindi ko po ma-translate in Tagalog, ano? Sometimes people say may acido po sa tiyan na bumabalik. That's the only way, that's the only way that I could describe it. So, in English, it is called when the stomach contents rise up into the esophagus, okay? So, yan po. Next question. It's actually not a valve. What separates the esophagus from the stomach? It's a sphincter. Hindi siya talaga valve, unlike heart valve eh. Pero parang nagtatighten din po siya. Pag maluwag po yon, then bumabalik po. No? It's not a valve like gumaganon. Hindi po ganun eh. It's a sphincter. What's a sphincter? Parang it gets tight. Parang yung sa pagdumi po natin, there's something similar like that between the stomach and the esophagus. Ngayon, pag lumuluwag po yun, it's not tight or meron pong problema doon, then we have what we call GERD. Ayan. Ita-tighten ko po, no? This is called the lower esophageal sphincter. Ayan. Okay? Actually, who is the doctor who looks after GERD? Usually po, it's a general physician lang or internal medicine. Pag talagang malaking problema na po, nagpupunta po kayo sa gastroenterologist po. Yan, that's it. The lower esophageal sphincter. Lumuluwag po yan, buwabalik po yung kinain nyo. Not literal na kinain nyo kasi po, it's not like clumps of food coming up, pero as the stomach digests it, nagiging acids po siya and it goes back up. Okay? So, yun po yun. Next question. So, for simple problems, it's usually the internist. Pag medyo problema na pong malaki, then it's usually po the gastroenterologist. Si Dr. Jun po, my best friend, is one of the gastroenterologists that you should consult. So, what are the causes? Yun nga, yung cause po, lumuluwag po yung sphincter. Hindi po maganda yung pagkasara. Pero I guess the better question for this are what are the conditions that could cause somebody to have GERD? Masakit po ito at nakakaabala. And this is a long-term problem. So some people have had GERD for years and years. Okay? So ano po yung mga risk factors? Wag na lang natin gawing causes. Palitan natin to risk factors. Or what are the conditions that could cause somebody to have GERD? Ganon. Number one po yung nabanggit po, older age. As you get older, somehow napapansin po nila that it is associated with older age group. Number two, obese. Sabi po nung ating nagtanong, she is chubby. So, again, as you become obese, it's associated with being chubby. So, sometimes people are told to lose weight po, if they have this disease. Again, people who are pregnant. Kasi po, yung matris po natin tumataas. Sa pagkataas po ng matris na may bata, naiipit po yung tiyan ng tao, and then somehow bumabalik po yung acido. So, pregnant. Also, smoking. May mga hernia po sa kanilang esophagus. And then, taking po of certain medications, eating a lot before sleeping, and of course, the kinds of food that you eat can all cause or become risk factors for GERD. Okay? Ayan. How to avoid GERD? Well, yung po nito is, it is often caused by the kinds of food that we eat. So, advice po sa atin ni Dr. June is to keep a food diary. Alamin niyo po kung anong pagkain ang inyong kinakain na parang inaatake kayo after. Some of the most common foods are citrus, caffeine, soft drinks, And ano po, energy drinks, ganun po yun, ano. Those are the things, citrus like suha, orange, ganun po, no? They can be known to cause GERD. Might be some others, so talagang ina-advise po kayo na mag-food diary kasi yung iba naapektuhan nitong ganito, yung iba hindi naman. So kailangan po ino-note nyo down ho kung ano yung kinakain nyo and how you felt after. So that is one way to avoid GERD. Changing your food and being aware of what you're eating. Another thing po is what we call the lifestyle changes. Lifestyle changes po, try to eat at least 3 hours before you go to sleep. When you sleep po, kasi para bumabaho talaga yung pagkain nyo. Okay? Number two, when you're sleeping, some people find it very helpful to have their head elevated. Kasi po, pag naka-flat lang ho yung ulo nyo, bumabalik talaga yung kinain. So, inaangat po talaga. My mom used to sleep po with 3 pillows and may board pa po sa ilalim ng kanyang mattress. So, parang feeling ko nahuhulog pa babae. But some people I do find it very helpful to elevate their heads. Ano pa? So, yun po yung mga lifestyle changes that we suggest. And then, medications. What are the medications that are useful for GERD? Number one, some people take antacids, yung maalox. People, as needed. Kung talaga pong hindi po nagwo-work doon, you may take po proton pump inhibitors, yung omeprazole, or H2 blockers, yung kinakilala pong Tagamet. Ngayon, kung talaga pong hindi po gumagaling, then that is the time that you need to see a doctor, probably Dr. June, or a gastroenterologist. And it would be good po for you to have an endoscopy just to make sure na GERD po talaga ang inyong sakit. And siguro, the next question, how after that, kung hindi pa talaga at masyadong grabe, then you may need to have surgery. Pero last resort na po yan. We do not do that very often. What is very important po about GERD is to make sure po, di ba nabanggit ho nung nagtatanong, masakit daw yung kanyang dibdib. It is very important po to rule out heart disease, lalo na kung mataba and may risk factors. Kasi baka akala po natin GERD yung pala inaatake na po yung tao. So it is very important to check po the condition of one's heart. Okay? So how to avoid GERD? Lifestyle changes, food changes, being aware of what you're eating, medications, and last resort, surgery. Again, losing weight might also help you. I forgot to mention that, losing weight. Okay? Next question po. Ayan, the side effects of GERD. Masama ba yung GERD? Oo, masama po yun. Kasi nakakaabala talaga ho yun sa buhay ng mga tao. It can be very, 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 very nakakanerbiyos, nakakainis, ang hirap pong kumain, kailangan pong pumili talaga ng kinakain. So, GERD can be very debilitating and annoying. Aside from that po, nagkakaroon din po ng erosion yung ating esophagus dahil po sa ng asidong pabalik. Yung iba pong tao nasisira ang ngipin because acid can destroy teeth. And lastly, if you keep having serious GERD po, it may give rise to cancer or cancer of the esophagus. So, kailangan pong batayan din po yan. Okay? Very interesting. GERD is extremely common. Napakarami pong taong may sakit nito. Almost 10 to 20% po of people in the Western world have GERD. So, it can be very, very annoying. Okay? Next po. Ayan na. So, those are it. So, summary, GERD is Gastro Esophageal Reflux disease. It is marked po by the taste of acid, sometimes chest pain, uncomfortable feeling po, and feeling nyo po bumabalik o nalalasahan nyo yung acido. It can cause chest pain and is chronic condition, pang matagalan and very annoying. Change the way you eat. Eat before 3 hours before you sleep. Try to review rin po yung inyong gamot kasi some gamots can promote GERD. And last resort, kung hindi po talaga gumagaling, even with medications, then it's time po to have an endoscopy. So yun po yun. That's what I can tell you about GERD. I'm very, very happy po to answer questions. Mabilis lang po yung ating talk, but we are open po sa mga questions. Okay? Eto po. More tips from Dr. June. Lose weight. If with night symptoms, elevate the head of your bed. Avoid alcohol. Stop smoking. Wear loose clothes. And some activities like gardening can increase pressure in the stomach to worsen heartburn. Naku po, nagugulay pa naman ako. Why? Because you're squatting so parang napre-pressure po yung tiyan nyo. Okay? So, yun po yun. Thank you for listening, and I'm happy to answer GERD questions and non-GERD questions. Okay? Thank you.
From Mr. Gilberto Abayon, may connection po ba ang GERD sa problema sa baga?
Well, actually, Gilbert, GERD is primarily an esophageal problem and a gastric problem. Kaya lang, we have sometimes what we call, bumabalik po yung acid, then sometimes we swallowing it, may go into our lungs and cause po, a form of chemical pneumonia. Pero it is not common.
From Miss Eileen Joyce Tagaza Fontelera, yung anak ko po, talaga po bang kambal na ito ng GERD, EA/TF. 15 months pa lang po siya, di na maaalis ang acid niya. Naka-maintenance na kami ng esomeprazole. Gusto ko sanang maiwasan niya ito. May mga way po ba or may mga paraan para maiwasan?
Yes, thanks. Sorry, naputol ko lang yung question. I couldn't hear the last part. But thank you so much for this question. And yes, GERD occurs in infants. Ikaw ba, Reyna, did any of the kids have GERD? Hello? Natatanggal po ata si Ma'am Reyna. But anyway, yes, GERD occurs in infants. Pero I'm not a pediatrician, so I cannot, narinig ko po talaga that you have to keep burping the babies. Ikaw ba, Reyna, did anything happen to your kids this way o hindi naman?
Hindi, wala naman, Doc.
I'm glad to hear that. Oo.
Yeah, normal lang naman daw po kasi yung anong tawag doon, lungat.
Yung nagre-regurgitate, yes. Oo.
Pero
meron talagang GERD sa bata. Unfortunately, I'm not a pediatrician po, so I cannot give you advice. But what I can tell you, may GERD po talaga sa bata.
Yeah, pero
they are advised po na na i-burp po frequently.
Yes. Okay. Next question po, Ma'am Kat. From Miss Rogine Bungay, totoo po bang iti-trigger ng mind ang acid?
Pwede po. If you're so stressed, I do believe GERD is also a disease of stress. Marami rin po, palalo na pag o baka naman if you're so stressed, you keep eating and drinking coffee, I don't know. That's why food diary po is very important.
From Miss Evelyn Ortega Gumabay, minsan masakit yung left na dibdib ko po, Doc. Ano po ang ibig sabihin niyan?
Ma'am, I mentioned this, no? GERD, sometimes, a person can have a GERD, tapos parating sinasabi, hindi, GERD lang yan, ang saksak na ng dibdib. Yung pala ina-atake na. So please, mga tao rin and mga doctors, just because a person has GERD, doesn't mean na wala siyang heart attack na pwedeng mangyari. So basically, take these symptoms seriously. And if they really, nag-iiba yung GERD nila, then they need a cardiac workup talaga. At kung marami po silang, like for example, risk factors for cardiac disease, they need a cardiac workup. Mahirap pong sabihin na GERD po yung chest pain na hindi nyo po inalam ng mabuti. Kasi we might miss a heart attack. Pero marami na pong akala nilang heart attack yung pala GERD. And thank God dala GERD.
From Mr. Jason Silaran. Hi Doc, na-diagnose po ako GERD then nagka-anxiety na din dahil sa symptoms. Ano po ba ang reason bakit matagal siya mawala kahit nainom na din ng mga proton pump inhibitors ng ilang months? Nagka-pneumonia na din po ako dahil daw sa acid, sabi ng gastro. Sabi naman ng gastro, no need na daw po ako endoscopy. Almost 2 years na po ako may symptoms pero medyo mas nakakakilos na po ako now compare nung 2020. Napapalala lang din ng pandemic kaya ako ninenervyos. Imbis acid lang, naiisip pa yung pandemic dahil sa symptoms lalo pag hirap po.
Ay nako, thank you Jason for this question. Yes, as I mentioned before, stress can cause GERD and GERD can be stressful kasi biro mo, hindi mo alam kung inaatake ka sa puso, sakit-sakit ng dibdib mo. Kung sino ba namang hindi ma-anxiety doon, I honestly, people with GERD tend to be very anxious. Kasi people always tell them, hala, baka sakit yan sa puso. And then check up ng check up, wala naman lumalabas sa puso and then eventually GERD. Pero always, sa back of mind nila, baka heart attack. So, naiintindihan ko po yung anxiety ninyo. Of course, once you're anxious, dumadami po yung acido. It's a cycle eh. And then, if you're anxious, you tend to eat more. Sometimes you drink a lot of coffee, comfort foods, kain ng kain. Paikot ng paikot yung problema. GERD is chronic, pang matagalan po yan. You need to change really your lifestyle dito po sa sakit na ito. Yes, yung binanggit nyo pong gamots can be effective, but sometimes not. And the most important po, pag matagal na po, like years, and you feel debilitated, it's time to do an endoscopy. Kasi po, sometimes GERD has an association with H. pylori. Wait lang itatype ko lang para kay Ma'am Kat. Ayan. Yan. That is the disease po, H. pylori. That is what causes po ulcer symptoms. So sometimes may ano po yun, may association. So it might be good to do an endoscopy po and check po if you have H. pylori po. That might be causing ulcers. So kung minsan they go together. So kung hindi kayo gumagaling, I would do an endoscopy. But again, gastroenterologist po, if I would suggest Dr. June Ruiz Medical City.
From Miss Maribel Arebado, kapag may GERD po ba tumitigas ang tiyan?
Normally, ma'am, hindi. Normally, hindi. But I wouldn't say na it couldn't happen, okay? Possible naman din po. Normally po na walang nararamdaman eh. Pag may GERD, nalalasahan talaga.
From Miss Annabel Suba Gonzalez, good PM po. Lagi po ako dumitighay at parang puno ang dibdib ko, lalo na po sa gabi.
Yan, ma'am. Dumidighay, kuminsan inuubo. Acid can irritate and cause coughing also. So one of the rare causes po of chronic cough might actually be acid reflux. So ma'am, kung sa gabi po talaga, then you need to eat less at night and then food diary po kung ano talaga kinakain nyo, ilista nyo.
From Mr. Osmer Vergara, is ranitidine safe to take?
It's called ranitidine. It's one of the gamots po. It's oo naman, okay lang po. Pero again, kung talagang matagalan na yun, it's not getting better, masusing investigation din po. It might be good to have yourself checked up. Ano po, ranitidine is a medicine that reduces the amount of acid that your stomach makes. Ano po, pwede po to lower stomach acid. My mom used to take this a long time ago. Kaya lang, parang may mga concerns na rin po dito about ranitidine. It is Zantac po, no? My mom used to take it like water. Lately po, may konting recall, but it's still on the market po, no? It's still on the market. Again, if you're not getting better, the most important po is to do an endoscopy.
From Mr. Ricardo Marian.
What is endoscopy? Okay? Kasi baka people will ask, what is endoscopy? Ang endoscopy po, it's a long tube, mahaba, no? Flexible. There's a camera at the end. Lulunukin nyo po yon. You are asleep, okay? Lulunukin nyo po yon. They will look po into your stomach and esophagus. They can also do biopsies based on that. So malalaman po talaga nila sa itsura pa lang po ng ng esophagus nyo and the connection to the stomach kasi nasusunog po na acido yon. So there will be changes that will be seen on endoscopy. And then they can also get biopsies kung nakikita po nila may problema. They can also check po for H. pylori. Yun po yung causes of ulcer.
Okay, from Mr. Ricardo Mariano Paras. Dr. Ana, ano pong gamot sa acid? Sakit ko po yan.
Naku po. Ayan. Sakit po talaga yan ng ano, the gamot sa acid, trial po first. You can take antacids for the ano, for the symptoms. Maalox po yan. After that, you can do the proton pump inhibitors po. And then you can also do po, you can also do po the proton pump inhibitors followed by the H2 blockers. Okay? So those are the kinds of gamots. Again, the most important, lifestyle changes. Baguhin ang lifestyle. Stop smoking. Stop drinking. Stop eating. Hindi naman who stop eating, but stop eating the foods that you think might be giving you acid. And it's different for different people. Okay? Or not giving you acids. Stop eating and drinking the foods that exacerbate. Nagiging mas grabe ang inyong GERD. Okay?
From Mr. Eugene Bungay. Totoo po bang na-trigger ng mind or stress ang acid reflux? Salamat po.
Yes. And it goes both ways. If you're very stressed, you can have more reflux. If you have a lot of reflux and you feel like you're having a heart attack, talagang may stress ka. And talagang hindi po maganda yung pakiramdam. So, paikot yung problema.
From Mr. Jose Erwin Bunag. Doc, ano po dapat iwasan para hindi po magkaroon ng GERD?
Really po, I think it's the food. I'm strong believer po in foods. Kaya po, sir, iba't ibang foods are triggers. That's actually the term, parang triggering. There are also some medications that can trigger GERD. You will have to ask your doctor po at susuriin po yung mga gamot na iniinom nyo. For the foods po, citrus, caffeine, soft drinks, coffee, tea, mabibigat na pagkain, very near to eating, and then very salty. So, iba't iba po, no? Pero I'm just telling you the standard na ina-advise po namin sa mga tao.
From Miss Catherine Manalili. Ang GERD po ba ay nakakapagpataas ng blood pressure po?
Well, literally po, hindi naman ho talaga mismo yung GERD ang magpapataas ng presyon nyo, no? Wala naman siyang direct effect on blood pressure. But, it is a very stressful disease. Ako, tapatin ko sa inyo, yung nanay ko had GERD for many years. She was told she had heart disease. Parang tumatak po yun sa utak niya. So, despite numerous doctors telling her na, no, ma'am, you only have GERD, wala pong problema yung puso nyo, parang nag-sink in na po siya sa kanya talaga. And talagang hindi po nawala sa kanya that she had heart disease even though she didn't. So GERD can be a very stressful disease kasi po, di mo, sakit-sakit ng dibdib mo, akala mo inaatake ka. That cannot help you. And it will really trigger po so many stressful events and stressful reactions. Mahirap. It's not an easy disease.
Okay, from Miss Pellegrino Caritas. Doc, 3 months na po ang aking pantoprazole na endoscopy. Na po ako, H. pylori at chronic gastritis. Prescribed medications and antibiotics. Okay ba yung maintenance ng pantoprazole?
What happened po dun sa when the H. pylori was treated? Did you get better? And then another thing po is sa akin, no, though medications play a big role po dito sa GERD, I am a big believer in lifestyle changes. So aside po dun sa gamot, baguhin nyo po. Are you overweight? Are you smoking? Are you drinking? Are you monitoring your food? Natutulog ba kayo, nakaangat ang ulo nyo? If you do all of that, it's possible po na you can get off medication. So ako po, I'm not a believer in extremely long term. Like years, masama po yun. Ano? May nag-years dyan. It's not good. Okay? So, sabayan nyo po ng lifestyle changes. But marami na po kayong ginawa that I had recommended.
Okay, I'm back. From Miss Annabel Suba Gonzalez, ano po ba ang dapat kainin at ano ang tamang oras ang pagkain po?
Wow, that's a really great question. Thanks, Miss Reina. Paputol-putol talaga internet natin. Nasa Pilipinas tayo. My answer to you is it varies from person to person what you should eat. That's why the word is, can you write food diary? I'm gonna type it for you guys. I'm gonna type it for you. Food diary. Yan. What is a food diary? Every day, ilista nyo yung kinain nyo. Okay? And then, at night, ilista nyo. Maybe you can rank your GERD positive or negative. And then, 1 to 10, kung sobrang grabe si 10, yan. Ilista nyo po yon. You will find a pattern. For example, kung inom kayo ng inom ng soft drinks, nag-GERD kayo. Pag tinanggal nyo lahat ng soft drinks, walang GERD. So, obviously, yung sagot, wag mag-soft drinks. So, ganun po, you have to observe. You have to observe what you're eating. Okay? Number 2 po, I would suggest to stop eating 3 hours before you sleep. Kasi po, pag humiga kayo, nagiging flat yung ulo nyo tsaka yung tiyan nyo, babalik talaga yung acido. Kaya, people are advised na iangat po yung ulo nyo when you sleep. Huwag naman yung nakaupo, but some degree po, yung mother ko had a plank under her bed. Ayoko nga ako nung malita kong matulog doon kasi feeling ko nauhulog ako. Kasi nakaangat nga po yung ulo niya. But thank you for that wonderful question.
From Mr. Jason Silaran, salamat po, Doc. Follow up ko lang pala, Doc. Ano pong pagkakaiba ng GERD sa GERD LPR? Then, totoo po ba ang low acid ay nakaka-GERD symptoms din? Lalo pagka matagal pong nainom ng pampababa ng acid.
Wait lang po GERD LPR. Yes, tama po kayo. I read this also. I am not a gastroenterologist, so I think we need to guess Dr. Jun na dito. Kasi medyo specialist question na po ito. There is a laryngoesophageal reflux. I have never seen it. I would ask Dr. Jun. Siguro i-guess natin si Dr. Jun dito, no? So, I have never seen, honestly, I have never seen LPR. But sabi po nga po nila, meron po talaga. Whether a condition of low acid can cause GERD, honestly, I don't know. Let me ask Dr. Jun. Okay?
Last question tayo, Doc. From Ms. Flor Torres Baritua. Doc, pwede po ba sa may GERD ang low-carb diet?
Pwede naman po. But again, food diary again. Alam mo, ang very interesting sa GERD, ang IF. Kasi may timed eating po yun eh. So, I believe you stop at 7 p.m. If you sleep at 10, maganda po yung intermittent fasting. Ito pa. Isa pa. Sorry. Ang intermittent fasting kasi, they tend to have the largest meal in the morning. Medium meal sa lunch, light meal lang sa dinner. Kung nag-GERD po kayo, you may try that. Eat most of your food in the morning. Pagdating, lalo na ho kung yung GERD nyo, napapansin nyo sa gabi, it might be helpful to really reduce the evening meal. And usually, na-achieve po natin yan through intermittent fasting. Okay, last question na po.
Yes, this will be the last question. From Mr. Pellegrino Caritas. Doc, ano po ang dapat gawin para di mag-rebound ng acid kung mag-stop sa PPI pantoprazole? Ang maintenance ko po will end December 25. Iwas na po ako sa lahat ng bawal. Pwede po bang mag-take?
I think you're doing, I think you're doing good, sir. Probiotics or food supplements, not proven po. But if you like, wala naman pong masama. Magagastos lang po ng konti, no? But I think you're doing the proper stuff. And my advice po dito is take it step by step. You can reduce it lang eh. Hindi naman po pwedeng i-stop kagad. You may try reducing it. And then again, sabayan din po ng lifestyle changes na mukhang ginagawa naman ni sir. I think you're on the right track. So sa inyo pong GERD sufferers, it can be very nakakainis talaga. Nakaka-nervous pa dahil akala mo ina-atake ka. But really, GERD is a lifestyle disease and we will need to change many of our food and eating habits to successfully control our GERD or Gastro Esophageal Reflux disease. So sa inyo po, magandang gabi po and stay safe and healthy.